Hi everyone, welcome to another question and answer session. This is the physiology. A man is admitted after a period of prolonged self-induced starvation. Nasogastric feeding is planned. Which of the following is least likely occur? That means which will not occur, or which is following statement followings. So the man prolonged starvation, and when he weak, then nasogastric feeding planned. And what will not occur? Here are the options. Options are hypokalemia, increased risk of cardiac arrhythmia, his hemoglobin will decrease affinity for oxygen, hypophosphatemia, and hypoalbuminemia. So which is least likely occur? That means in case of starvation, which usually not occur. So first of all, we have to read about the refeeding syndrome. Here we can see the refeeding syndrome. It declares metabolic abnormalities which occurs on feeding a person following a period of starvation, and the metabolic changes occurs. So the metabolic changes which is usually occur after a long period of starvation. It may be self-starvation, or it may be any other form of the starvation. So what consequence includes? Here we can see the hypophosphatemia, that means the phosphate reduce. Hypokalemia, that means potassium reduce. Hypomagnesemia, that means the magnesium also reduce. Abnormal fluid balance, that means fluid abnormality, and this abnormality may ultimately lead to organ failure. So this type of abnormality, that means the phosphate, potassium, magnesium all reduces. If patient not eaten more than 5 days, aim to refeed less than 50% of energy and protein level. That means if any patient non-feed for 5 days or more, in this condition energy should be given 50% or less than 50%. That means the normal requirement of calorie should be reduced 50%. So here we can see the high risk of refeeding problem. So who are the high risk? BMI very low, that means less than 16, that means malnutrition. Unintentional weight loss more than 15% over 3 to 6 months. Little nutritional intake more than 10 days, and hypokalemia, hypophosphatemia, hypomagnesemia prior to feeding. If two of or more of the following present, that means BMI less than 18.5, unintentional weight loss 10% over 3 to 6 months, little nutritional intake more than 5 days, history of alcohol abuse, drug therapy including insulin, chemotherapy, diuretics, and antacids. So refeeding syndrome may occur this condition. So when there is severe one condition is enough, but when the patient is relatively healthy, then 2 or more conditions required for refeeding syndrome. And for refeeding syndrome, the food usually given by 50% less, and here we can see the starts up to 10 kilocalorie per day, 10 kilocalorie per kg per day. That means usually normal requirement 20 to 30 kilocalorie per day, but we reduced it by 50%. And full needs over 4 to 7 days. That means after 4 to 7 days, then full calorie should be given. And the supplement should be given oral thiamine. Here we can see this is the oral thiamine, vitamin B complex, and other important supplements. And also we have to give the potassium, phosphate, magnesium, because this level also reduce due to long time starvation. So what is the refeeding syndrome? The process of starvation may lower the DPG. So the starvation, it reduces the DPG, that means 2-3 bisphosphoglycerate or diphosphoglycerate, and this DPG usually used from glucose. It derived from glucose in glycolysis pathway. So when a person less feeding or starvation, he or she usually not taking the glucose, so typically 2,3 DPG or 2,3 BPG will reduce. In practice, unlikely, it occurs early as generated during glycolysis. Here we can see this line that during glycolysis this DPG usually produce. Altered metabolism in starvation may be more acidic and also tend to impair oxygen carriers. So one of the important cause is the reduced DPG, and reduced DPG it increase affinity of hemoglobin to oxygen, and another one is the acidosis, and this cause also hamper the normal oxygen carrying capacity. So what is our answer? Which is least likely, that means which is not occur. Which is not occur, hemoglobin will decrease affinity for oxygen. It is not true, because hemoglobin it increases affinity for oxygen and reduce delivery of the oxygen. Other options here, such as here the hypokalemia, that means potassium reduce, it is true. Increased risk of cardiac arrhythmia, it is also true. We know that the cardiac muscle is very sensitive to potassium, and any alteration of potassium it causes cardiac arrhythmia. It may be hypokalemia, maybe hyperkalemia. So hypokalemia, hyperkalemia both can cause the cardiac arrhythmia. Then hypophosphatemia, that means the phosphate level reduce. Hypoalbuminemia, that means the albumin level reduce. That means in case of starvation, all the food materials, all the electrolytes reduce.